As a future dentist, you're stepping into a profession that's changing faster than ever. And one of the biggest transformations you're going to be a part of is teledentistry. But look, it's so much more than just video calls. It's a complete rethink of how we provide care, and it's especially important for us right here in Malaysia. So in this explainer, we're going to cover 6 key areas. We'll kick things off with why teledentistry is so critical, then we'll define what it actually is, dive into its benefits and challenges, take a look at where it's headed, and wrap up with what all of this means for you.
Okay, so before we get into the nuts and bolts, let's start with the most important question. Why does this even matter? The truth is, teledentistry isn't just some cool new gadget. It's our answer to a really critical public health problem.
I want you to picture this. A patient, maybe in a rural part of Sabah or Sarawak, is in a lot of pain. But your future clinic is hours away. For them, that distance and the cost of travel aren't just inconveniences, they are real barriers that stop them from getting the care they desperately need. And that's the core question teledentistry is trying to answer. What if we could bridge that gap? What if we could bring our expertise and initial care directly to people in communities that have for a long time been underserved? You see, this completely flips the traditional model on its head. Instead of the patient always having to figure out how to get to us, we're now finding ways to bring the clinic directly to them. So we know why it's important. Now let's get really clear on what teledentistry actually is and, how it works.
So here's the formal definition from the American Dental Association. Really, it's just the dental-specific part of the much bigger field of telehealth. It's all about using technology to close the distance when we're delivering oral health care.
So how do we actually do it? Well, it's not a one-size-fits-all thing. Think of it like having 4 different tools in your toolkit. First, you've got synchronous care. That's your live video call, where you're talking to a patient in real time. Then there's asynchronous, which is a store-and-forward approach. This is where maybe a community health worker sends you photos of a lesion to review later. Remote monitoring is awesome for things like orthodontics, letting you track a patient's progress without them needing to come in. And mHealth is all about using mobile tech for simple but really vital stuff, like sending out hygiene tips or appointment reminders.
All right, now that we know what it is and how it works, let's get to the really important part. What are the actual proven benefits of bringing this into our daily practice?
So to make this super clear, here's a typical asynchronous workflow. First, someone collects the data. This could be a dental hygienist at a school or even the patient themselves at home. Then, that info gets sent securely to a dentist. The dentist reviews it all remotely and comes up with a diagnosis and the treatment plan. Now, this doesn't replace hands-on care, but it's a really powerful first step for triage and planning. The biggest benefit, no question, is breaking down those geographical barriers we talked about. It really extends the reach of dental services to rural, elderly, and other underserved populations who might otherwise just go without any care at all. And think about it from the patient's perspective. They don't have to take a whole day off work, pay for a long bus ride, or find someone to watch the kids. It's way more efficient for them, and honestly, it lets our practices streamline things like consultations and follow-ups. Now, here's a huge clinical advantage. When it's easier for patients to get that first check-in, we can catch problems like caries or oral lesions much, much earlier. And as you know, that means simpler, less invasive, and way more affordable treatment for them down the line. Teledentistry also totally changes how we work with each other. It makes getting a second opinion from a specialist so much faster. It can help cut down long wait lists for consultations, and it lets us continuously monitor a patient's condition between their in-person visits. But of course, it's not all smooth sailing. To do this right, we have to be really honest and clear-eyed about the challenges. First up, the technology itself can be a hurdle. Let's be real, not all patients are tech-savvy. The initial setup costs can be a lot for a clinic to handle. And the irony is, the rural areas that need this the most often have the spottiest internet. But the biggest clinical limitation is obvious. You just can't replace the tactile feel of a physical exam. Then you've got the legal and ethical side of things. We have a serious responsibility to protect patient data under Malaysia's Personal Data Protection Act. That's non-negotiable. We also need really clear regulations on practice, a solid process for getting informed consent, and we must absolutely guarantee that the quality of care we provide virtually is never, ever less than what we provide in person. But despite all those challenges, the momentum is undeniable. So let's take a quick look at the journey of teledentistry and where it's headed next. Teledentistry isn't actually new. It started way back in 1994 with a U.S. Army project. But it was the COVID-19 pandemic that was the massive catalyst, forcing everyone to adopt it super quickly. Today, we're at a really exciting frontier, integrating artificial intelligence to help with diagnostics. The future is pointing towards these fully integrated, proactive oral health systems. And it's so important to see AI for what it is, a powerful tool. It's like a diagnostic partner that can help analyze radiographs or score patient risk. It's here to augment your clinical judgment, not replace it. It actually expands what you're capable of as a practitioner.
So this brings us to the final, and I think maybe the most important point. What does all of this actually mean for you as you get ready to start your career? Understanding and embracing these technologies? It's not optional anymore. It's a core competency. It's what will empower you to serve your community more effectively, to help close that access gap we started with, and to really be part of redefining modern patient care. I want to leave you with this powerful quote because it perfectly reframes this whole topic. The point is, teledentistry isn't some futuristic idea we can think about later. It is an active, immediate, and essential part of our professional responsibility. And it starts today. The real question for your generation of dentists isn't if you will use these tools, but how you will use them to build a more equitable and effective oral healthcare system for everyone.